So what led you to become a SANE, and like where did you go to get training? I know some of it maybe has changed over time, but where did you go initially to get your training? Are you certified or not? Tell us a little bit about what actually led to you becoming a sexual assault nurse examiner.
I kind of already mentioned kind of like why I got involved, and I immediately sought out a 40-hour training in Kansas City. It was a citywide collaboration between some of the major hospitals, where all of those managers, directors, coordinators came together to bring in the community agencies to provide their piece of it. So there was victim advocacy for domestic violence, sexual assault, etc. So it was the 40-hour training provided by 30-some individuals. So it was very comprehensive. Then I am certified. About a year after I started this practice, I did get certified. That test is a whopper. I will never let that lapse. Okay.
Absolutely.
But just to give like some numbers so that it gets helpful, there are approximately, there's a little over 105,000 nurses in the state of Missouri and only 14 SANE certified nurses. 14, and that's actually less from the previous year due to turnover, or there's actually a lot of hoops you have to jump through to maintain that certification of getting CEUs that are specific to the objectives in the test, right, lady? Mm-hmm. Yeah. And then also providing education to the community and outreach, so that you're not just so that you're doing both things, Group A and Group B. You're getting education, but then you're also putting it out at the same time. So you have to have so many hours to recertify. So.
Well, I am not certified because of the whopper of the test. It is my ultimate goal to be certified. I love what I do, and there will be a time where I will sit at a table and I will say, yes, I am SANE certified, but I am currently not at this moment. I need to get over the fear of the whopper-ness of the test.
And Jen just really helps you.
I will get there though. I'll be the 15th hopefully. But I really, like I said previously a little bit, I love the autonomy that I have as a SANE nurse. I can go in and I can care for that patient individually of a physician. I always offer them the care of the physician. They're in an emergency room and they have the right to that medical screening exam by a physician. And I specifically say I am not a doctor. I cannot take care of you if you have a broken bone, but I can take care of you in this aspect. I can prophylactically treat you for any STIs or emergency contraception or HIV medication that you need. I can, treat for minor pains and aches. And I love the fact that I can sit one-on-one, and through the training and the knowledge that I have gained, I can care for that patient individually on my own, autonomous from a physician. So I love that. I love that concept. And that's really what empowered me to go through it. Because a lot of physicians would refuse or not want to take care of sexual assault victims. You have to have the compassion and the heart and the want to do it. Mm-hmm. And a lot of physicians are like, I don't want to go to court. I'm not doing that. Okay. The amount of times that you will go to court caring for a victim is very low number, unfortunately. Like she said, the number one thing we want to go to court on every case. We want to catch that person. It's very rare that you're going to go to court on a case, unfortunately. But I just love the fact that I can go in and care for a patient and give them the compassion and the time and the patience that they need for what they're going through at the time.
And your initial training that you went through, was it also a 40-hour? Was that also in Missouri?
Yes, ma'am. Sorry, it is. It was 40 hours. It was actually 50 hours because they combined 40-hour lecture and then 10-hour skills set. So it was actually a 50-hour course, but it was in Missouri. It was in Springfield. There's the company organization in Springfield, Cox Health, always puts on a SANE training, usually about 2 times a year, and everyone from the Southwest region of Missouri will come to that training. Anybody's allowed to go, but you can get online, you can research where SANE training is at. There's some available trainings online as well, but that is the one that I attended.
Where did you go?
I have done multiple, so it kind of was in phases, kind of like Jen was saying. The beginning was still that 40-hour requirement set by IFN, but it still was not near as in-depth and kind of just skimmed the surface. So then when we started to improve our program, we had someone come in and do one of those trainings until I became certified. So then now I do our trainings, but then I have also gone to the Santa-Palooza at UMKC, so I went to that a couple of times before I even started doing things on my own, and that just does like a hands-on proctored education with teaching patients. That's really, really beneficial, because then it allows you to really take what you learned in the class and practice it. I mean, you can't really do that easily on actual patients, so to be able to do that on non-stressed out patients is really nice. And so that's how I started, was those trainings. Just, I said multi-layered, but you got the basics and just kind of added to it from there. So.
And you did the same P training too.
Yes,
Yeah.
I did. We don't see pediatrics either. We transfer 14, or I'm 13 and younger, keep 14 and above. But we still see a lot of pediatric patients, and so I feel like if we're gonna see a lot of those and we're gonna transfer them there, I wanted to have more knowledge still myself, and so I went and did Children's Mercy pediatric training as well.
You always
really
have
helps.
you always have to expand your knowledge and go to whatever training you can. Initially, you have to have that 40 hours, which is like she said. I think everyone at this table has continued their education
Oh, yeah.
and sought out. I went to the same training twice because I wanted the extra knowledge base, and I have gone to this pediatric training. Although I can't be your pediatric provider, you want to go to whatever certification training possibilities you could have to help grow your knowledge and educational base of a seniors.
But starting out realizing it is baby steps.
Mhm.
I mean, and because you don't really have the capacity to like take all that in the beginning, you're just getting your foundation and then building from that. But that if you do want to be effective and really grow your expertise, that it is going to be like a continual process that you just keep building on. So
Well, I started working doing forensics, as I said, in 1989, before we had SANE. St. Louis was very late in getting the SANE program. It started throughout the country in the mid-70s. Our first SANE training was in St. Louis, was in 2000, so really late. I did a lot of research, and I remember going to Columbia and learning about how to set up SANE programs. And we were really fortunate. That first SANE program that we had, we brought in Glenda LeDray. And so she's kind of like the guru for forensic nursing from Minneapolis. And so I took that training, but back then it was so basic. I mean, it was like, do this, but not really showing you how. It was all, I remember a lot of it was on burnout and things that, like, it's not really even hardly relevant anymore per se, compared to all the other information that we absolutely have. I mean, burnout's fine for ER nurses, but not, it's not so much for, I'd rather have a little bit more about how to collect a swab properly than, stress related to my job, although however important. But so we had our first training in 2000. And then from there was nobody in St. Louis to go to as mentors. So I had to do it by attending conferences and go anywhere I could to learn all that information on my own. And then in 2005, started actually doing the training, because there was nobody else available to do the training. So it's kind of how we got to this point.
So if somebody's interested in going through the training to become a SANE, there are training programs available throughout Missouri. And you've also mentioned a couple times IAFN. What is that? How can it be a helpful resource for folks who might want to seek more information?
I have to say that IAFN has actually been one of the biggest helps for me, despite the controversy around it, in terms of keeping up my skills. When you're sitting in a little area where there's nobody else but you've got to get that information. The International Association of Forensic Nurses has a bulletin board where people write in and ask questions, and so you learn what topics are going on throughout the country. They have a lot of resources. So as far as a resource, they're excellent. They provide the certification exam and the recertification, among other things, but they have a little backbiting going on and some issues. They're restructuring their exam, so soon you'll be able to take the
That's what I've heard. Whenever
So they're rebuilding the
when that exam comes out, let me know, because that's what I've heard.
IFAN has recently done an online SANE course, so I can't speak to it. I haven't taken it. I did have a nurse recently that took it, because we were kind of in between having a course at our hospital, and she really wanted to do it, and I heard really positive things. with anything, and I think we'd all encourage it no matter where you end up. I mean, there's always kind of that baseline, but then what is the beauty and then the heartache of this area is that it's so jurisdictional based too. So from area to area, you really have a lot of variety. And so even if you take it, just making sure that you get back to your local and find out. But they, that was something that's, you know, a nice alternative that you have 12 weeks to complete it, I think. And it just kind of do it at your own pace, but has a lot of, I heard really, really good information. And so, and they have listed on there a bunch of opportunities also, like across the state and then throughout the U.S. So.
And they have a Journal of Forensic Nursing peer review articles, CEUs.
Well, you're saying Palooza was in there.
Santa Palooza was in there. Yeah, so it's that's a wonderful resource, and it encompasses not just SANE but also correctional nursing, and then forensic psychiatric nursing. So it encompasses the full umbrella rather than just it's grown.
They have a lot of excellent webinars that are archived on
sure.
there. It's probably one of the best resources to go to as far as SANE-related material. Forensics in general it's really a good resource.
Especially if you're getting started, once you can, because it just is a great network and they're very good. Their online community, you know, if you really wanted to get in touch with someone in a specific area, it would really at least help you get connected to other professionals and find that mentor.
And it has a list of all the different programs and their addresses and phone numbers and who the contact person is. And
Has a list of their SANE certified nurses, so if you need to contact someone, you can look at that and see who in your city that you might want to reach out to, and that's anybody can get that list.
And that's something that the MCA DSV is also happy to help with too, because all of y'all have talked about the importance of that mentorship process. So if anybody ends up watching this video and is interested in seeking training and looking for a mentor to connect with, they can contact MCA DSV, and all of y'all would be interested in being a mentor. Correct.
Yeah, absolutely.
Speak to that because this lovely soul, I mean, everyone's lovely, but it's just so imperative, especially if you're not to be intimidated to get started, because you're all going to come from different places in your institution. I would love if everyone, for their sake, came from one that already had a program so you didn't have to fight that battle so much. But if you are starting at ground zero, like there's people out there, and Jen has been nothing but that person for me, and there's been a lot of other people too. But you know, if you really love the cause and devote most nurses and the same nurse of forensic, like we just want to help sisters out, you know, your brother and sisters out. We just want to help and grow the cause, and so you need to have someone. There's going to be so many layers of like, okay, well, how do I start this? How do I maybe overcome some things in my hospital? Or what you'll learn, and what another challenge is just like no case is the same. So even though you learn so much, it's just constantly evolving. And so to be able to, you know, within the confines of confidentiality, be able to call someone and be like, hey, this is kind of what I encountered. You know, how could I have done better? What would you have done with this? And like, it's imperative, and it will help you out so much if you feel like there's someone that you can call on and vent and get encouragement and ideas.
And I think that any SANE nurse, anybody that has a SANE program, if you reach out to them to help, the number one thing that we find is that there are so many hospitals that do not have SANE programs or do not have SANE nurses, but victims of sexual assault walk into every emergency room across the state of Missouri and across the nation. They don't know where the SANE programs are at, and we never want a victim to be turned away and say, we don't do that here, we go somewhere else. Likely they're not going to go anywhere else. Or have someone, I remember the first kit that I ever did. I stood there and I read the instructions, because it was before we had a program, and someone said, here's a box, figure it out, the instructions are in there. That's how I was trained to do my first one. And same concept that she said, you don't ever want to have to stand in front of a patient reading the instructions in a box when they've gone through that. So for anybody that's in the state that does not have a program or doesn't have any SANE nurses, and you want to be that person and you want to start that program, reach out. There are many more people than just the four of us that will help you, because we want every hospital to be able to care for every patient that walks through their doors, and sexual assault victims and victims of domestic violence or human trafficking they don't discriminate to what hospital they choose to go to. So we're willing to help out anybody in the state of Missouri get off the ground to be able to expand that knowledge base across the state.